If you want to know my guide on how and when to push athletes harder, you need to tune into this episode. Uh, Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know my guide on how and when to push athletes harder, you need to tune into this episode. Before I go on to the podcast, what is new? What is life? Happy New Year's to everybody. This is recorded right after the New Year's of now going into 2023. Excited to make some big changes in 2023, and I'll share those in this podcast as well. But what is new? What's better? Good time away with the fam. Just to kind of reset, those of you who've been following me in the podcast understand I really value time with the fam, and it really gets like my brain to actually like go crazy because it just gives me time away and it allows me to think a little differently. And it is amazing just how refreshed I come back. And so that was good time away into the New Year's. And what is going on with the fam? My wife is excited about New Year's, but she's also not. She knows that this is the time where I go ham. I go to town on upgrades and everything else that I want to do with the fam and with sports performance and with the Garcia Academy. So for her, she just shakes her head right about now. So if you ask her or you talk to my wife, she knows it's a very tough part of the year. What's happening right now? I'm doing a lot of annual planning just for myself and all the teams that we have at Sports Performance and really forecasting what the new year looks like for our team and our organization, just to be able to continue helping people along the way. So there's a lot of planning going on right now. Good, exciting news. We have some stuff. We have some more growth within sports performance. We have more team members coming on, and we're hoping to grow in the upcoming year. So I'll have some more announcements there. What is happening with the Chris Garcia Academy? The Kickstarter, the Sports PT Kickstarter officially starts next week. I'm excited to see everybody who has enrolled, and it's 8 weeks of a lot of content. So be ready. There's some homework assignments behind the scenes, so be ready for some projects. All right, on to this podcast. Why am I doing this podcast? So when we talk about getting athletes to a certain level, I've had a lot of clinicians ask why I approach treatment so aggressively, or I would say progressively, but why I do that. And there's a lot of reasons, but working in pro sports really gave me a different view into what is possible. And what I mean by that is I got to work with some of the best athletes on this planet, right? Some who set world records, US records, whatever it is. And I realized there were some of these individuals who didn't care what the treatment was. They were willing to just do everything and anything to get the job done. And what that does as a clinician, it allows you to tap into something that not is not as common in the orthopedic realm. So prior to this, yeah, I did my residency and I met really good athletes at the Ohio State University and everything else, but everything is on the line for pro athletes. Like they're getting paid to do a job. So there's no limit to what they're willing to do. And as a clinician, it allows you to explore how much you can push past what is typically thought in the orthopedic realm. Why? Because these people are asking for it. And so what that allowed me to do is be a little more creative. It allowed me to push a little bit more. And so as I pushed more and more, I got feedback from the athletes like, oh, that's a little too much. Or actually, we did it. Like that was perfect. And I was like, oh my gosh, I would have never thought to. But it was because of these people who were willing to learn with me. And I was very upfront about that. Like, I don't know if this is a good idea for us to go this hard, but we're going to try it for the next 3 weeks. What we'll do is, we'll map this out for week one, we'll be a little more aggressive. Week two, be higher or more aggressive than that. And week three, we'll base it off of week two. And they're very honest about they're like, hey, I'm willing to try it. If this is what I have to do, let's try it. So that allowed me to have a different lens. And then I just transferred it over. Once I stopped traveling and doing everything else, my wife said, hey, we have to stop traveling. We wanted to establish a family in San Diego. that's when I really said, okay, well, can we transfer this onto the community members? And that's when I started exploring it. And believe it or not, community members were interested, just as interested as some of those pro athletes. Now you might be like, well, not the patients I see, or not in my clinic. Believe it or not, there's people out there who are willing to, who just haven't had the chance to. So I just started doing it to community members, and lo and behold, there was just a whole community of people who really wanted it, and that's where I continue to treat the same exact way that I did with pro athletes, and that's what I've done. So when we talk about this podcast about why and how to push athletes harder, it's based off of that premise that I am using the same principles in pro sports. Somebody has to compete in 5 days. They're willing to do anything. So that means that there's a lot of people that you're probably serving who are willing to push a little bit more. So the question becomes, why aren't you? Is because one, maybe you don't have the tools or the resources. Number two, that you don't know what to do. Number three, you don't know how to start. And this podcast is really off of that. Like if I can give you some of those basic frameworks or toolbox, then essentially that gives you a little bit more power and leeway to be able to implement that into your community. And that's what I'm trying to do. So that's why I'm doing this podcast. Okay. All right. So so if you don't push people to their limit, right? Like if you don't, let's assume that person wants to be pushed. Okay, so that's the underlying factor here. Let's assume that person wants to. That it's a patient or an athlete. They want to do more. If you don't do more, what's the harm? No one gets harmed, but what you're doing is you're limiting their potential outcome. It gives them a chance to maximize their potential. Number two, it could limit their adherence to you, and they're like, I'm going to find somebody else. And for those who've heard my podcast in the past about the well-informed athlete, some of these individuals nowadays who are Googling and YouTubing everything before they come in, they're looking for a specific type of provider. So if you're in that domain where you're looking for people to stay with you and you want to stay committed to these people, and you don't want to have people being lost to other providers who are more aggressive, then this is something for you. So number one, it'll improve your outcomes. Number two, it'll allow people to stay with you longer. And what I mean by that is instead of seeing somebody else, they're probably going to stay with you. Okay. So what's it? Okay, so what's the solution? What do we do here? How do you start? When do you know how hard and like when to push? So let me tell you things what to avoid. Before we start talking about like what to do, let me give you some yellow and red flags. Um, Anytime that I have a pushy parent or a pushy coach, that's a yellow flag to me, meaning does the athlete want it or does the parent or coach want it more than the athlete? That changes the whole relationship. And I'm 100, I'm a parent myself, so I'm, my son Zach and my daughter Alex is 6 and 4, and Jacob's a year and a half. I know, I'm gonna look back at this podcast and laugh. I know in like a few years, I might be that pushy parent. Like I might totally be that person, but I understand that. So I am now on the flip side of, am I pushing too hard? Or whenever I hear that or I see a parent who's pushing, if the athlete's not motivated, it makes it very difficult to push them hard because you're not really doing it for their own good. You're doing it because it's some external like influence is telling you what to do, and that's always not the best quality of care. And you can risk a lot of injuries and everything else. So I'm telling you what to look for, what to avoid. Be aware of the pushy parent or the pushy coach. Uh, so another thing is if somebody doesn't have a timeline, meaning somebody doesn't have a target goal, right? So say someone's post-op or they have an ankle sprain. If they don't have a timeline, like I want to be ready in 4 weeks, I want to be ready in 2 weeks, I want to be ready in 6 weeks. Those are all timelines, those are goals, those are endpoints. Whenever you have an endpoint, it's easier to push somebody or push them to the point where you know you can be a little more aggressive with them. But if they don't have a timeline, they're like, rotator cuff or an ACL, and they're like, nah, I'm just good. I don't know if there's a reason to really push them. And that has to make sense to you. Like, why would I push somebody who doesn't really want to be pushed? Now, if they're pushing just to push for like that, it doesn't make sense. You risk re-tearing, re-injuring. I don't think that that is the beneficial way to look at this. So just those two alone tell you like, okay, then if those are the people you serve, then you don't need to be pushing your athletes harder than they currently are. And I think that's important for you to know. All right, what are other ones? Going too hard or too soon, going too hard too soon. So if you have somebody early in the stages of healing, I don't like to be aggressive early. Why? Because I've learned, I've made a lot of mistakes, and I don't want you to do the same. In pro sports, you have this open window to treat however you want, how aggressively you want, but your results are everything that determines your success. So I would try and push hard early on, and that got me in trouble. I thought, well, I mean, they're pro athletes, they're young, their tissue healing's great. Let's just push. And I pushed too hard, and it forced them to miss more games or more events they needed to, and I felt really bad. And so, going too hard too soon, what I would say is in those first two stages of healing, the first 48 to 72 hours, phase one, and then the first 2 weeks, I do not go aggressively unless I have a specific timeline. So don't go too hard too soon in the first phases of healing, 72 hours or 2 weeks. Do not, unless they have a timeline. So number one, avoid doing it or pushing too hard if you have a pushy parent or coach. Number two, pushing too hard if someone doesn't have a timeline, and avoid going too hard too soon in the first two phases of healing. The next thing to avoid is moving on to the next phase of healing without hitting milestones. So there are two ways that you can look at progressing somebody through rehab, right? There's time-based and there's criterion-based. So time-based would be like, well, if I have somebody who is in the first phase of healing and they're going to be at week 9 post-op. My next phase is at week 12. At week 12, we'll add in new exercises, and at week 16, we'll add in more. Now, if you go off of that, that's no problem. However, you also have to have criterion-based healing or progression. So meaning they probably have to have full strength before adding resistance. They have to have full weight and full strength before adding, load or, adding intensity. So if you don't have those qualifiers beforehand, it doesn't make sense to advance them. So you have to look at both criterion and time-based. So what to avoid is moving too fast into the next phase without hitting criteria or milestones. Now, that might be intuitive to you, but it's a friendly reminder. If you avoid these four things, what I tell you in the context, if you have a motivated athlete, those four things will keep you at bay, and it tells you what to avoid and what to be aware of as you progress people. So if you have anybody in those four elements, you kind of know this is probably not the candidate to be doing that. So in my head, my algorithm, as I treat athletes, this is what I'm going through in my head. Does this make sense? Am I going to push a little hard? Who's asking me? What's the timeline? What's the milestones? Do I go fast early? That's what's going on in my head. And those are the four things to avoid. So with that, if I have those qualifiers out of the way and I have a motivated athlete, I'll inquire first. So you have to inquire early. And what I mean by that is I use a certain phrase. I'll say, hey, listen, we can progress more aggressively or more conservatively. Which route do you want to go? And that allows them, now they have this headspace of like, wait a minute, I can go like harder? Okay, perfect. So I inquire early. And the second part to that is I inquire often. So even though at the front, at the initial evaluation, they said, I'm going to push hard. And at week 2, 4, 6, 8, I'm still inquiring, and that's often, and they might be like, whoa, I'm a little sore, I gotta back off. And that's okay, because I knew they were motivated to start, but they can't handle the load, or they can't handle the intensity, whatever, their tissue can't handle it, whatever it is. So step one, figure out all the things to avoid. Step two, inquire early, inquire often. If you don't do that, you've pushed somebody all the way through, and they're at halfway through the rehab, and you're like, hey, we can be more aggressive. They're like, well, we just wasted all those weeks. We could have gone faster. And clinical practice is about learning and adapting, right? Developing more clinical reasoning, stronger clinical reasoning. And the limit to your clinical reasoning is the lack of reflection, right? Constantly looking back. If you ask me, Chris, like, were you practicing the way you are now, like at year 3, year 4? Oh, it's a cumulative effect. It's exponentially greater every single time that you take on new things that you learn. So the fact that I inquire early and often, that was just years of mistakes, probably 6, 7 years of mistakes that I should have done that from the very beginning. So if I do that now, the patients and athletes that I see now are going to they're going to get so much more benefit and outcomes just purely off of that one factor. Because if you waited too long, you were missing so many weeks of potential accelerated rehab. So inquire early, inquire often. All right, so that's number two. Number three, you have to create the roadmap. And you've been following me long enough, you understand the roadmap is key. If you don't have a roadmap, you're not a clinician. You're like a let's see how it goes type of PT. And so if you don't have a roadmap, it means that one, you don't have the clinical skill set to do it, or number two, you just haven't thought about doing that. And that's okay. So a roadmap is basically a projected timeline of the expected results in a given time frame. What I mean by that is basketball player comes in, sprained ankle, and they start their season in 10 weeks. Can you project week by week what their progress will be like leading into week 10 and estimated return to practice, full play, and what will happen as they enter week 10? Week by week, progressing all the way through, project it before you start treatment. That's a roadmap, right? Some will call it a plan of care. It doesn't matter to me. Create the roadmap, because what it does is you actually thought about this person and what will happen. Physical therapists are notoriously bad at this. They'll be like, that's okay, we'll try next week. We'll keep trying next week and we'll see what happens next week. And we'll see what happens. And what happens is you have this slow return to sport. And if you do this projected roadmap, believe it or not, your outcomes are going to increase. Why? Because it forced you to think about things that you weren't doing before, meaning you were projecting. PTs are really bad at projecting. What they're good at is just 2-week timelines. Yeah, well, in 2 weeks you're going to be great. You're going to be doing this. When can I go back to practice? Well, we'll reassess next week. Let's see how you do it. And all you're doing is just buying time to not mess things up. It's just slow rehab. So if you really want to have accelerated rehab, you actually have to create your roadmap. Create the roadmap, whatever the timeline is. So 6 weeks, 8 weeks, 12 weeks, 6 months. So if it's an ACL, 10 months out, wants to go back to soccer, I think that's easier. Post-ops are easier for PTs to understand because that's that's an easy surgical protocol. But how do you do that with atraumatic, insidious onset injuries? It's the same thing. It's just you haven't been able to think that far. So create the roadmap. So if you've figured out who to avoid, right? We have a motivated athlete with none of those red flags or yellow flags. You've inquired early and often, and they say they want to do it. Perfect. You've set the roadmap now. Perfect. All right. What's going to hit you that you don't know about yet is to have a plan A, B, and C ready. Once you have that plan A, B, and C ready, meaning at week 3, what can go wrong? At week 4, what can go wrong? At week 6, what can go wrong? Week 8, if this goes wrong, where am I going? Just having a different pathway so that way you know where the potential poor outcomes may arise. And it tells the athlete, hey, if you don't get it at week 2, week 4 you can catch up. At week 6, it's not even possible. So if you don't get this done by week 4 and you have full range of motion and you can jog, at week 4 gives us a good timeline where we have 6 weeks to get you back to on the court and full throttle practice. It gives them a good projection of what they need to work on versus when can I go back to practice? Or we're going to see every single week and see how you do. What that does is like you're relying on hope. It's just hopium. Like you're just like, well, I hope it gets better. What that is a clinician who hasn't forecasted or thought about this person's rehab. And I mean, you can probably shake your head and think about all your coworkers and colleagues and all these other PTs you've ever seen. They just didn't want to like put the work in. And that's really what a roadmap is. It requires work behind the scenes. But once you do enough of these, they're easy to do. So you know who to avoid, inquire early and often, get that roadmap, have plan A, B, and C going. All right. So who do you look for? Once you have this out, like like now you know who to push, how often, when, and why. All right. So what do you look for? Or sorry, I didn't tell you when to push. I push at healing phase timelines. So I push at uh, if your first phase of healing is 72 hours, then I know I can start pushing the day after that. If I know I can push at week 2, I'm going to push right after that. But I have to hit time base and criterion. So I know my time base are critical to soft tissue healing. If I have all the time in the world, of course I can hit healing phases. If I have a short timeline, man, that's a little tougher. I now have to look at criterion more so than time because time is irrelevant if I have a short timeline. So I will look on criterion time, but if healing phase timelines, if I have a short timeline, I have to go criterion. I have to. But when do I push? Healing phase timelines, 72 hours, 2 weeks, 6 weeks, 10 weeks, 12 weeks, whatever that is. I just go at those markers, and then once I hit criterion. So it's not too hard. You just have to know when those things are, when those healing phase timelines are, which means you have to actually project and do the roadmap. All right, what to look for? Who are you doing this to? Who are you advancing? What athletes are you pushing more and more often? Uh, People with stagnant healing, like, so let's assume they're motivated. If I know that they're hitting a threshold and their healing is like they're plateauing, they're like, I'm hitting 90%, and I'm just kind of sitting there, a sitting duck. I've hit 90% and I have one more week to heal. I can push a little bit more because they've hit the threshold that I want. The criterion was hit even before the healing timeline. I'm like, all right, I can push that a little bit more. So people who are hitting goals and targets criterion wise a little early before the healing phase is done, I'll push a little bit. That gives me more wiggle room. Now, you have to account for those. What are your criteria and what's the time to achieve the marker? So if you're like at week 6, I need you to have full knee range of motion. I need you to have full terminal knee extension. I need you to have a quad set straight leg raises and step ups or step downs, 10 repetitions with no mechanical challenges. If they hit them, no mechanical challenges, no swelling, and straight leg raises, and they hit the full knee range of motion at 5, you can push a little bit more. See what I mean? So you have criterion hit early. They have 1 or 2 weeks before the time point. You can start to push a little bit more. As long as the criterion is there and they have no exacerbations, you're not risking too much. That's where you have to balance out, like, what are my options here? So the next person, it goes off of that. Somebody who's hitting 90% on criterion very early is somebody that I will continue to push because they're hitting demands, the 90% demand, and without exacerbation, and the subjective report is high. Why not? Let's keep pushing. You need a motivated athlete. Now, the exception to all this is if you have a short timeline, meaning what happens if an athlete says, hey, I sprained my ankle and I have a game in 3 weeks, and it's a grade 2 and they need 6 weeks? One of the toughest stories I've ever heard of, it was this high school soccer player, female elite soccer player. She had a grade 2 plus. Oh, it looked nasty. She was one day out from it and she needed to return to play in, I think, 4 weeks. And we were like, a grade 2, 4 weeks, that's a little tough. She was 16 at the time. And I think 7 days later, she came back to the clinic and we were like, okay, great. Let's take a look at the range, all the stuff. And it was like beautiful, looked great. It was still a little like ecchymosis and everything else. But I asked, okay, so what have you been doing? She's like, I went back to practice, like full practice. I was like, what are you doing? No, you can't do that. She's like, it felt good. And so it's cases like this where you're like, man, like there's theory and then there's like practice, right? Like there's some people who just adapt faster. So you kind of have to always figure out who's my athlete, what are the risks here? And with all these factors, this is how in my head, my algorithms, how I teach my team. So whatever you're learning here is literally how I teach my team. How do you address how much to push, how often, and why? This is the algorithm. Here's the things to avoid, when to push, have the plan, have the roadmap, have the plan A, B, and C ready, inquire early and often, and here's the things to look for. This is how you do it. Now, when you put it all together, and you're like, okay, Chris, if you can summarize how and when to push athletes harder, I think you have to figure out the who first. Is this a motivated athlete being pushed by themselves? They are internally motivated. That's step number 1. Number 2 is that you inquire often and early. Is this something you want? Yes. Great. Set the target and figure out exactly what's going to happen with a roadmap. Now, review all those things often, every single week, every single session. Just because you make a plan doesn't mean that week by week it might change. That's the worst mistake you can have. So review often, keep pushing until you hit 90% on all your criterion. And then you can advance them early within healing timelines. And then constantly retest, constantly retest. You're almost skeptical that this person is lying. And when you do that, you can't be wrong. They're saying, hey, I want to advance faster. And you're like, perfect, I trust you. However, I'm going to continue to inspect what I expect. So I'm going to constantly reassess, retest. And you're like, you're 90? Let me see. Retest. You are 90. Let's keep advancing. Next test, linear hop test, whatever that is, 90%, you're 3 weeks early. Let's push it a little bit more. Now, it doesn't mean that you skip healing timelines. That's not what I'm saying. I'm saying advance them sooner in a timeline fashion if they're hitting the markers. Give them a chance, give them a little wiggle room. But what you have to acknowledge first is that they're internally motivated, number one. They have a timeline to work towards. And number three, that you are constantly skeptical of them advancing at the rate that you're doing. And if you do that, that's a sound, that's a sound plan that rarely would go wrong. I mean, there's exceptions all over the place. I've been wrong many times. But I will tell you, if you're like, I want to advance my professional development, the reality is you probably haven't been given permission by your parents, sorry, by the patients or the athletes. Your patients and your athletes are the ones who are like there to give you permission, meaning you have to inquire and they're like, I'm in. They've given you permission to do it. Number two, how do you not mess up the case by going a little bit more aggressively? And number three, once you retest and reassess, those are your checkpoints. Am I doing this right? Yes. And when you do those three things, man, you're on the right track. This is literally how I do it. And I've been able to help thousands of elite athletes in the same fashion. And, 99% of them will come back and say, like, I really appreciate that. I really, I'm grateful to be able to get back to the, fights or we have a lot of UFC fighters that we work with, and we have a lot of like soccer players, pro, all over the place. And what that allows us to do is push a little bit more when you get people who are motivated. So if you ask me, Chris, why do you treat so aggressively? This is it. Like, this is why. I wouldn't call it aggressive. I would call it progressive. And no other reason than why not? I mean, you're a physical therapist and you learn to push the boundaries as you go on and on. And wherever you are, if you listen to my podcast on the phases of professional development, there's rules of four. And the first 4 years, you're just learning the lyrics on how to like sing this song called physical therapy. And the next 4 years, you actually start to like learn how to dance while you sing, right? You just like you develop the clinical reasoning that you've seen. I've seen this before. I don't have to think too much. I'm still being able to like, I still can read research and kind of determine if I'm gonna need to use this. And that third 4 years is really where you start to like learn how to dance and like put it all together. You can actually sing. You can listen to the lyrics plus sing and do all this stuff. What I mean by that is you're putting on a show, and it's a really good opportunity for you to have a good time with your patients and athletes. This is not a job. This is a professional opportunity to help people do more. And if you see it as boring and I just see people getting out of pain and that's all good, then push the limit and help them do more. And what this does, it just opens up your eyes to new opportunities. My last podcast was on being able to provide patients and athletes with injury prevention, but that wouldn't be possible until you're exposed to it, until you push people, until you offer it, to you be a little bit more aggressive, more progressive. And when you keep pushing the limits, people realize like, oh, you don't just treat my knee, like you can actually like help me with preventing injuries, but you can also help me push a little bit more aggressively. I'm used to just like the same banded exercises that I come and you give me a piece of paper with 55 exercises and I come here twice a week for 2 hours and that's supposed to magically make me feel better. If you're tired of doing that and you're in that, like you're tired of the hamster wheel, like start to look at other opportunities. One is look at injury prevention. Number two, on this podcast, we're talking about how to push people faster. And people appreciate that because time to a lot of people, they value it and they want to get better faster. They love you, but they don't love driving a half hour to see you, a half hour back, an hour out of their day to be told the same things that could have been found on YouTube or Google. So consider all these things as you continue to develop. But how do you push faster and harder? Just using the same steps I have here. And you might need to listen to this a couple times. So don't be afraid to, because you'll get stuck in certain positions. Like, okay, what's the next step? Then you just create the roadmap, plan A, B, and C, figure out what to avoid, who to look for, inquire early and often, and just push to 90%, retest, and you're in a good place. So, I think ultimately when I thought of this podcast, I thought of the clinicians that I see on a regular basis that I mentor, and it's always the like, how do I do it? That's always the question. And so for those who inquired, the reason why I did this podcast is because I know that people want to do it, they just don't know how or when to do it. And I wanted to be able to help you out. And so if for those of you enrolled in my Sports PT Kickstarter, you'll get all of this in the content in the mentorship group. And for those of you who are like, okay, I understand this and I get it, but I want a little bit more. And so because of that, I created my Sports PT Kickstarter online mentorship course. And if you're listening to this beyond January of 2023, it's a little too late because the course just started. But for those of you who are still interested in the next like 8 days. This is going to be a great course for those who are looking for a development of clinical reasoning. Like this is the clinical reasoning course. Yes, it's exposure to acute injury management. Yes, it's exposure to like how to push athletes faster. Yes, it's exposure to strength conditioning. Yes, it's exposure to acute injury management and injury prevention. But ultimately, it's like how to do it and then when to do it. And a lot of courses, the Con Ed courses will always teach you like what to do. Here's the mobilization, here's exercise. I'm teaching you like why and when to do it. And what that does is it allows you, it's 8 weeks, this course is 8 weeks, and allows you to take week by week review of how you're progressing. And I have a couple assignments and projects that'll help people really like, okay, is this working for me or not? It'll test your limits and you'll realize I'll give you clinical case studies and it gives you an opportunity to reflect. And that's the thing as a clinician, that's really hard to if you don't have people around you. And so I built this course to be able to provide mentorship, to be able to put a community together so that we can have this journey with 8 weeks to be able to help you determine when and how to do the next move within your professional development. So for those of you joining, I'm excited to have you. For those of you who are interested, go onto my website, drchrisgarcia.com/Kickstarter. Join the course. If not, I will see you guys on the next episode. All right. Take care, everyone. See ya.